Good evening, ladies and gentlemen. Welcome to the KSOS-IJO collaboration webinar, Publish and Flourish. The Kerala Society of Ophthalmic Surgeons is honored to host this program. Unfortunately, the KSOS President, Dr. Arud Chakravarti, is unable to join us due to certain unanticipated developments, and he sends his apologies. Now I request Dr. Gopal Pillai, Secretary KSOS, for his welcome address. Dr. Gopal.
Thank you very much, Dr. Smita. It has been indeed a pleasure. This program of Journal Club, started and spearheaded by Dr. Sudha, now given over to Dr. Smita, has actually done real wonders. The first edition of this was seen by more than 30,000 people. I mean, that's a huge, huge number. When you compare it as a journal club, pure science. So kudos to both of you for taking this program forward. Kerala Society of Ophthalmic Surgeons have been in the forefront, kicking up more and more programs week after week. And it's so difficult to get a slot. And that is what Santosh sometimes says. It's very difficult to get some slots sometimes. So this particular program is in collaboration with Indian Journal of Ophthalmology. As you know, IJO has taken to new heights, real, top class journal levels, thanks to the editor, Dr. Santosh Honawar, to his efforts, and all the associate editors and all those other people who are working behind him as well. So this program would, have speakers both from KSOS as well as national arena. Starting with Dr. Sudha. Dr. Sudha is trained in Delhi, MAMC, but she's now professor at the Kerala University of Health Sciences. And she's the immediate past editor of the Kerala Journal of Ophthalmology, who knows the power of the difficulties and powers and perils of an editor. And then we have, Dr. Santosh Honawar, none other than Dr. Santosh Honawar, trained at RP Center and then at Philadelphia, Shields Blue-Eyed Boy. And he is currently the chief of plasty at Center for Sight and the editor of the Indian Journal of Ophthalmology. I just told that he has brought us to new heights, which I hope he will be talking to us soon about. Dr. Smita Narayan, again, professor of ophthalmology at the Kerala University of Health Sciences, currently in Trivandrum, and the anchor of this particular program. She is the brain behind this particular program. And then Dr. Nina. Nina is a pediatric ophthalmologist at Giridhar Eye Institute, trained in Shankar Nethralaya. And she also has a lot of publications and gold medals to her credit. Chaitra from Bangalore, she's a vitreoretinal surgeon. She has been long associated with the Indian Journal of Ophthalmology. She is working in Narayan Nethralaya and does a fabulous work. And then we have Dr. Deepak Mishra, who is professor at RIO Benares Hindu University. And he has won 30 gold medals and 7 books and about 85 publications. I mean, these people are really very, very good, and they are going to enlighten us over the next 1.5 hours. Dr. Praful Maharana, he is trained in RP Center in cornea and anterior segment, currently associate professor at RP Center. He has more than 150 publications, and we welcome Dr. Prafulla. And finally, Sabyasachi Sengupta, who said he will join us a little late. He is a vitreoretinal surgeon working at Future Eye Care, and he runs a lot of training programs in research methodologies. And he's also assisting Dr. Santosh as an associate editor. So this is a wonderful, wonderful group of people that Smita has put down today for this wonderful program, Publish or Perish. Over to you, Dr.
Flourish.
Publish
or perish.
And
perish and flourish. Yeah.
Thank you very much, Dr. Gopal, for your kind words. Now I request Dr. Srini Adaklon, Chairman, Scientific Committee of Kerala Society of Ophthalmic Surgeons, to offer his felicitations.
Thank you, Dr. Smita. Hi, everyone. It's a great privilege for Kerala Society of Ophthalmic Surgeons to associate with IJO and the great Dr. Santosh Honawar to conduct this program. As Gopal said, Dr. Santosh has taken IJO to great heights, unimaginable heights, so it's very kind of him to plan a program along with KSOS for the benefit of everyone. KSOS in fact has been doing a lot of scientific activities, and all these activities are well appreciated. Our scientific committee CME series is getting huge viewership. Even the CME series program on low vision age, which we don't really expect that much viewership. That even that has crossed 2,000 views. So our programs and the PG training program that Gopal is conducting, that's gathering popularity with every program, and journal under Dr. Smita is we can't really expect it to reach IJO levels, but she's taking it to great heights. So it's I'm not prolonging further, because we have to get into the academic part as soon as possible. So thanks a lot, Dr. Santosh, for partnering with KSOS with this program. Thanks a lot, everyone. Thank you.
Thank you, Dr. Srini. Now, coming to the actual program, we have an interesting lineup of topics and some stellar speakers. So tonight, let me begin by requesting Dr. Sudha V, who will be speaking to us on why should you publish. So Dr. Sudha, as Dr. Gopal previously mentioned, is a professor at the Government Medical College, Idukki, with special interest in medical retina. And she's also the president of the Thrissur Academic Club of Ophthalmology. She was, as previously told, immediate past editor of the Kerala Journal of Ophthalmology. Over to you, Dr. Sudha.
Thank you, Dr. Smita, and thank you, Dr. Santosh Onawar. It's an honor to be here with such eminent speakers on this subject, and I hope with my small contribution I can try and make some thing to this program, some additions. So actually, I'm a little sorry. I'm talking from the Idukki, so my internet connection is a little poor here. Let me try and share my screen. Can you see?
Not yet. Yes, we can see. Make it slideshow.
Yeah. Okay. Can you see now?
Yes.
So good evening to all. My topic has been, why should we publish? Now, when I became editor-in-chief of Kerala Journal of Ophthalmology, then I realized the importance. Before that, I was also like, why is everybody talking about publications? Why is it so important to publish? So let me just go through you with what is the importance? What are these journals? What are these scientific researchers telling us? Why do we need to go into this publication for all the youngsters who are watching this program? So we all know that research is the way to go through a scientific discovery. We have to do research, and that is the way to progress. But your task of research is simply unfinished until you publish your experiments. And the others have to read it, interpret it, analyze it, and inform you how good the topic is or how good your research is. Publications are there to help to create a shared academic culture, a scientific culture which is shared amongst your peers. It is advancing the art of science. It's a continuous quality improvement. It is teaching you how to go through evidence-based methodologies. So it is facilitating evidence-based science, which is reproducible and transparent. When you do publish an article, it is going to help you how to interpret other articles, how to learn through looking at the results, how to analyze those results, how to interpret those results, so that we don't take every other article for granted and take it as the word for science. We should be able to analyze that article and use it for our own purposes. So according to Santosh Nagar himself, he says countries, journals, institutions, and individuals, they're ranked in research based quantitatively as well as qualitatively. Quantitatively on the number of your publications and qualitatively on the number of citations. So let me talk about various parts of this. So as an author, there are a lot of benefits for you. Why do you want to publish? Because you're sharing your knowledge, which you are claiming as the priority knowledge, because you are doing this. So sharing knowledge with your peers and claiming the pleasure of priority. Of course, you become an expert in that field. So there is it's a measurable, the number of publications are a better measurable academic score over others. And of course, if it's a good research work, it confers credit to you. Why do we want to do that? It is not just for sharing the knowledge, it is also creating a competitive advantage. I am better than you. It provides criteria for your ranking among the national and international authors. We all know the dictum publisher perish, as Dr. Gopal has already said. So what is this? This is a self-marketing strategy, a carrot and stick approach. The carrot is that if you publish, we will give you jobs, we will give you promotions, we will give you grants. But if you don't, the stick is that you are going to perish. In your scientific world, you will no longer be known if you do not publish. So publications are definitely an entry into the academic culture. But it's not just that. Once you start publishing and you see those articles in various journals, you get a satisfaction. You get the thrill of innovation which you've made with your research. It builds enthusiasm for you because you're getting more and more recognition. And because this is a permanent mark in history, it is leaving a permanent record. It's giving you a mark. You are there for whatever time that you can view that publication. Putting our research also helps us to know what are our further research goals. And once that research is available for all, it prevents unwitting duplication and subsequent waste of time and effort by others. And not only that, the peer review will tell you, as the ages go, the peer review, obviously science will advance and there will be further and further changes. And this gives valuable feedback for improving further. And specific areas like an editor and reviewer, you do definitely need publications, especially managing a huge journal like the Indian Journal of Ophthalmology. You definitely have to have a large number of citations. There are other benefits, academic and clinical benefits. One we have already talked about, that we are for promotions, this is important. But other than that, publications are actually helping you in your practice, in your clinical practice, because you are coming to know what are the global standards of treatment. We are talking about clinical treatment. So what are the global standards? This we can research through our publications, through others' publications. So it provides, while we read this literature, we come to know on lesser aspects. Because of anything that you are writing, you need a wide reading of literature on that subject. Your writing will have skills in writing. It will teach you what is ethical writing. It will teach you how to improve your teaching methods to others. And of course, your number of publications and the way you do it acts as a motivation to your students, your undergraduate, postgraduate students. Benefits of research is that your research can provide new ideas for others' research. Your published article will be the foundation stone for better research. It reevaluates old concepts. It promotes cooperation among people who have like-minded ideas. For institutions, if you publish your successful publications, number of publications, that brings attention to the institution. That institution has a name because of your scholar, because of the scholars and their publications. It provides criteria to select those. If they want for especially teaching faculties, they can select those who have larger number of publications. Again, collaboration among like-minded institutions, quality rankings and academic excellence, new program approvals. Our country has the Indian Council of Medical Research, which basically is a national institute which collects people has for different program approvals based on their publications and based on their interest in research. So it is also is an accountability indicator for allotted research resources and state policies, because once you've been given resources and the state requires you to publish the accountability, what have you done in research, and maybe in their journals. So in fact, the national education policy has already talked about sharing of resources for research, merger of single stream institutions. These single stream institutions may not have all the facilities of research, so they are planning for merger of these institutions with multidisciplinary institutions for research and capacity building for faculty, which includes on how to improve their publications. What are the benefits for a journal? Now, I came to know this when I was in the Kerala Journal of Ophthalmology. An academic journal needs articles which are reliable, readable, but the most important part that they should be published, they should be actually there enough to be published on time. The journal has to be published and published quarterly or monthly. Those good quality articles are needed. High number of recognized authors and editors will improve our chances for further indexing and citations. And higher the indexing or the impact factor, there is better impact the cycle. The more the citation, more the chances of better articles being published in your journal in time. So, seeing this importance of the journals, of the publications, the KJO and the Kerala Society of Ophthalmic Surgeons had an initiative undertaken to improve the quantity and quality of the articles published in the Kerala Journal so that we can plan to go in for higher indexing. So this consisted of a series of research mentorship programs. It was mainly meant for ophthalmologists who are also doing busy clinical practice. So there is a lot of data, but most of these practitioners did not know what to do with the data. So the aim was to foster the idea of research and improve the visibility of the journal as such. So it consisted of a number of programs, basically a 2-month research mentorship course, and about 81 members of the KSOS joined it. Also, some of them further went in for editorial and review training. Journal clubs and CMEs were also conducted along with this. So during this, we asked them what was the reason for them not publishing. And most of the people said that they did not have time. But they also, an important group of people also said that there was lack of knowledge about research methodology. Data collection also was difficult for most of them. So all the participants in that were encouraged to prepare a research project with data from their clinical practice, and they were given guidance in writing the manuscript, and they were encouraged to publish it in the Kerala Journal. And during that 2 months, I think we had cycles of this. 42 original research papers and 1 review articles were submitted to KJO. And 39 papers are still undergoing and currently under process. Some of them have already been published in the Indian Journal of Ophthalmology. And so we are now planning for higher indexing. So the take-home message is that publications are necessary to the vital, they're vital actually to the growth of science, because it is a way of promoting academic culture and an important criteria for career progression, especially people who are now going to join medical colleges and jobs like editors and reviewers. And since research training is deficient for most of us when we are learning, that should be an integral part of our academic training. Thank you very much.
Thank you, Dr. Sudha. That was actually very motivational, the way you have shown us why publishing is so important. On my part, I feel that any research or its publication, which comes with contribution for patient management guidelines, that is what the practicing ophthalmologist would like to have. And that is one of the practical ways of translating research from research benches to the patient's bedside. Do you have any comments to say on that? Or do you feel that's not enough?
Is that to me?
I'm sorry?
Dr. Santosh.
No, it's to Dr. Sudha first. It's to you.
What, I'm sorry, I didn't get your question exactly.
No, my question was, my comment was that the research that with its publication, that is which contributes towards patient management guidelines. That is what a practicing ophthalmologist needs, something which is translated from the research benches.
That is why I said research methodology training, especially for clinicians, is very important. Because their data is there, it is available to them, but they are too busy and they don't really know how to input this data into actual publication. So that is why research training is important for them. What are the aspects of publication? I'm sure Dr. Santosh and others will talk about this. But that is what is important, because it's not the lack of data in India. Definitely we have data, but how to interpret it and how to put it into a scientific manner into a journal is very important.
Yes, thank you. Santosh, would you like to comment on it?
No, even for a reader, for that matter, some amount of training is required as to what to take from a particular research article, because generally they get lost in data and then, the gist is often ignored. So actually they have to try to interpret data that is given in a particular article in a very holistic way, and then take the summary of it into their clinical practice. And that some of the clinicians lack in terms of training. So reading journals is an art by itself. You can't read from first line to last line and hope that you have understood everything. And not all that is given in a particular article may be, translatable into your clinical practice.
Yeah. Thank you, sir. May I go to the next presentation? Okay. So we now have made a shift from publish or perish to publish and flourish. Now, this is more of a positive statement, and that has the right Boolean operators also. So now I request Dr. Santosh Honawar to tell us why we should publish in the Indian Journal of Ophthalmology. And as Dr. Gopal said, Dr. Santosh obviously needs no introduction. I'll just mention 2 awards of the many, many that he has received to underline his stature. He is the first Indian to receive the Lifetime Achievement Award from the American Academy of Ophthalmology in 2019. And he has also been conferred the Honorary Fellowship of the Royal College of Ophthalmologists, UK 2020. So we are all ears, Dr. Santosh Honawar, for your presentation.
Thank you, Smita. Thank you for your wonderful initiative. I think Professor Sudha spoke very eloquently about why to publish. The summary of it is that you want to be discoverable, your research should be accessible, and it should be reusable. And in other words, it provides the author or the group of authors academic immortality. After all, we are all gone. That is how people will find us in PubMed, possibly. And the next step, of course, once you've done good research and you have written an article, is to find a good journal for publication. Mismatch may be a style statement, but not in academics. You have to find the right match. But then there is a jungle out there. Sometimes it's confusing for a beginner author as to which journal would he or she wants to publish in. So what is the definition of a good journal? There is no one definition, but then there are many criteria as to how to say a particular journal is good or not. So you consider many factors, one of which is journal of professional repute. It should be an index journal so that your article is findable in the database, that is PubMed or any such database. It should be ideally published by a professional society. For example, ophthalmology is an official journal of American Academy of Ophthalmology, whereas IJO is the official journal of AIOS. KJO is the official journal of KSOS. Similarly, there are many journals which are official journals of professional societies. The review time has to be compact. You cannot take 6 months or 9 months for peer review. It should be a defined period. Generally, 6 weeks to 8 weeks is considered optimal. The journal should be regularly published to date, and it should have a reasonably good impact factor. The publication time after acceptance should be reasonable. About 3 months is considered reasonable. And more importantly, your targeted audience should read the journal. For example, your research is India-centric, then the journal should be read by Indian ophthalmologists, or it should be accessible to Indian ophthalmologists. So out of all these, the three most important factors to choose a journal would be scope, repetition, and turnaround time. Scope mainly depends on the match of the article that you have written to the kind of articles that a particular journal publishes. Photo essays, images, case reports, and case series are not published routinely by major journals, and they are published as part of separate journals such as IJO case reports or American Journal of Ophthalmology case reports or BMJ case reports, etc. Surgical techniques are also not published generally in a majority of journals, and they are specifically published in certain journals only. Whereas clinical research in the form of original articles, topical review, meta-analysis, and translational research are mostly published by a majority of journals. So you have to know your audience and tailor your publication to that particular audience. Reputation is gauged by many factors, one of which is years in publication. IJO is in its 70th year of publication. It should be published by a reputed professional publisher. It should have a good impact factor or site score or both. It should ideally be PubMed indexed. We already talked about the fact that a journal, good journal, should be a publication of a reputed professional society, and your peer group should be aware of the journal and they should be regularly accessing it. At this point, I would like to bring to notice the issue of predatory journals. There are many journals which are by an unknown publisher, who have unknown journals which have unknown editors, solicit publications for a hefty publication fee. They are published with lightning speed, with or without any peer review. They're not indexed, and you don't find them in directory of open access journals. And also you will find them in these two lists, which are specific directories of predatory journals. If you have any such journal in mind, please don't proceed further, because these will not bring you credit. These will only bring you discredit. Next, I'm going to talk to you about why should we actually publish in Indian Journal of Ophthalmology. Indian Journal of Ophthalmology is a reputed national journal. It is the official journal of All India Ophthalmological Society. 25,000 AIOS members have a potential to access it. Not all of them do access. Our opening rate for online journals is currently about hovers around 50 to 60%, which means that about 12 to 15,000 of AIOS members at least open the email. I don't know how many actually access it, but of course that is a good rate actually. In print journals are accessed by less than 3,000 or 4,000 people. Otherwise, they don't even open the packet in which the journal is sent to them. Online journals are easy to access, but look at the number of hits. So if these are just the members of AIOS, how is it that 500,000 online hits are there for IJO every month? So obviously it is reaching every part of the world. Since it is a open access journal, everybody can access it without any charge to access or download fee. So it's going everywhere in the world. And the number of citations for articles that are published in IJO can be very high. In fact, many of the COVID articles that we published have 200, 300, 400 citations. Your peer group reads it, and most importantly, residents and fellows read it. IJO has a very good lineup of editors who are all very reputed, and they have built a legacy over time. The cover pages of IJO are attractive, inviting readers to open the journal and look at the inside pages as well. These are some of the cover pages of Indian Journal of Ophthalmology over the last few years. And currently we are featuring some of the living legends and some of the legends who have passed away on the cover pages of Indian Journal of Ophthalmology, so that this actually brings the legacies of these individuals closer to Indian ophthalmologists. IJO, in fact, published the most number of COVID-19 related practically relevant articles and practice guidelines with very high citation indices during COVID times. One of the articles that was put together in 2 weeks' time because of a government demand that they wanted data on COVID-associated mucormycosis. This was a study of 2,826 patients at the height of the second wave of COVID. This data was collected and put together in 2 weeks' time from over 100 centers in India. This was commended as one of the best studies of the year by American Academy of Ophthalmology. Articles that was put together in 2 weeks' time because of a government. All right. So IJO has a nice website which is currently run by Lippincott, and also IJO has social presence on many of the social media platforms, including Instagram and Facebook. What has happened to IJO in the last 5 years is that the number of submissions from India have increased from 575 to 2,785, which translates to about 500% increase. Increase in overall submissions has been from 1,000 odd to about 3,823, about 380% increase. Increased number of published articles because of the increased number of submissions has also grown by about 500%. Consequently, the number of citations has tremendously increased from about 1,400 to now about 4,700. And impact factor has risen remarkably from 0.835 to 2.969. And for the next year, the anticipated impact factor is 4.2. That is as predicted by the publisher, which brings IJO into the group of decent or standard journals. What is most significant is that the last 6 years, we have added about 2,000 new unique authors to the pool of Indian researchers. That is about 10% of AIOS membership, not as first authors, not all of them, but at least as part of the authorship of published articles. These were never there, or they had never published in Indian Journal of Ophthalmology earlier ever. And what has it done to the country is that India was ranking sixth. It's not a bad ranking. It was a respectable ranking, way ahead of Australia, Spain, Turkey, South Korea. But we were lagging behind many other developed countries. We were in number 6th position in 2016. In 2020, we have risen to position 3, just below US and China. Of course, we hope to overtake China in the near future. US is a tough game because it's more than 4,000 publications, but that's a respectable rise that India has had in the last 5-6 years. Number 3 position is a good position. New initiatives for those of the clinicians who can't write an original articles for lack of time or don't have interest in doing kind of organized research. They can always put together a case report from the kind of unusual cases that they have seen, or a different kind of a management strategy that they have employed in a particular clinical situation. So IJO case reports is on its path to indexation. It may take about 18 to 24 months for it to get indexed, but retrospectively, everything that is published in IJO case reports will also get indexed once the journal is indexed. These are some of the cover pages of IJO case reports. And the power of internet is here. Even before it is indexed, the journal has been found by authors from over 24 countries who have been regularly submitting to IJO case reports. So it has already gained some kind of a good reputation that it is a reasonably good case reports journal, and there are increasing number of submissions every month to IJO case reports, although it is still not indexed. IJO videos is a new initiative. This is mainly for clinicians who do good surgeries but fail to kind of report it and in the form of an article. They can easily edit these videos, put together a nice commentary and submit it. And the IJO videos is indexed from its first issue itself. It's become a part of IJO itself. And you can see it listed in PubMed, and the URL of the video is given in the PubMed abstract. And anybody who wants to access this can directly go to YouTube link and access the video. And PubMed publishes the complete abstract of IJO videos. So with all these initiatives, IJO is coming closer to clinicians and serious researchers across the spectrum of Indian ophthalmology. Thank you so much.
Thank you very much, Dr. Santosh. Then this tremendous success of IJO, I feel, has actually filled the Indian ophthalmologists with a lot of pride and hope. And I think more and more people would now want to chip in. So, and another thing that I liked was that you have now set the targets within our site. You have shown us that how much we are behind China or how much we are behind the other countries, so that there is something achievable in it. So, which again, I think is something which motivates people. Dr. Sengupta, as the Associate Editor of IJO, your contribution has been tremendous. How do you view the spectacular journey of IJO?
Well, very good evening to all of you. And I think Santosh sir has already shown us, what can be done and, where we can go, to what heights we can go. My contribution has really been supportive, but he is the main, he's looked at the vision is his and the execution is also his. So, just that the sky is the limit, and, IJO impact factor, because the same year citations are not counted in the, in the ways impact factor is calculated. Therefore, we are slightly below 3. Otherwise, we should have gotten above 4. So, lastly, he's a tough act to follow, and, whoever comes in the next team is going to have a lot of things which have been done, but then, the sky is the limit. So, that's what I had to say about this.
Thank you.
Yeah. Next talk is by Smita herself. She is professor at Regional Institute of Ophthalmology, Trivandrum, and also the editor of Kerala Journal of Ophthalmology. She is also part of IJO as an assistant editor, and her interests are in glaucoma and also in research methodologies. Smita.
Good evening, ladies and gentlemen. So today I'm talking about literature search and reference management. And both of these are important building blocks for publishing. So what is literature search? One, it is the systematic and well-organized search from already published literature. And therefore, it helps us to practice evidence-based medicine. It also helps us to identify good quality references on a specific topic, meaning that it enables us to dig deeper. In other words, it is a thorough search of all types of published literature so that it helps us in identifying the lacunae regarding a specific topic in medical literature. So this unmet need of our times, that is the most important thing which helps us in formulating our research question. So mostly the literature search can be done from the electronic sources or from the print sources, or even from secondary sources like the textbooks or from the government publications or the dissertations, or even from unpublished data. So although there are many search engines and databases, I use the PubMed and Google Scholar mostly. So once you know the basics of search in PubMed, search in other databases becomes easy. And what is PubMed? PubMed describes itself as a free resource supporting the search and retrieval of biomedical and life sciences literature. So today I shall be giving you a few pointers about how to conduct a search in PubMed. So before actually going into PubMed, I think you should open a Word document and copy paste your research question into it. Your research question should not only have the FINER finer aspects, but most importantly, it should be having the PICOT aspects. That is, it should tell us about the population that you are studying, the intervention, the comparator group, if there is any, the outcome, and the time taken. Then break the research question into the main concepts and try to get keywords for those main concepts. So these keywords, an ordinary Google search would be also helpful to get the keywords. And get the synonyms of the keywords and the variant word functions. I'll discuss about the variant word functions in truncation, and check your spelling. So once we have got these things ready, then we can go into PubMed and use the Boolean operators to join our keywords of the search. So these Boolean operators are AND and, OR or, and NOT not. In biomedical literature search, we mainly use and or. Now, these Venn diagrams on the right side, they tell us about how these Boolean operators work. So when I use and in between two keywords, I get a search result which contains both these keywords together. So using and actually contracts the search. On the other hand, when I use or in between two keywords, it expands the search. We get results which contains either one of the keywords or both the keywords. And so it is an expanded search. So PubMed automatically gives precedence to and. So much so that if you search without adding any Boolean operators, then also you will find that mostly and has been added between the keywords. PubMed previously wanted all the Boolean operators to be used in capital letters, but I think now it doesn't need that. A few other pointers include nesting, that is putting brackets around the same concepts together. So the concept of nesting is actually similar to the concept of placing and opening brackets like we do in algebra. So when you use groups of keywords joined by different Boolean operators, it is best to use brackets to keep concepts that are similar together so that these keywords will be looked by the database first. Secondly, if we are looking at phrases, then it is best to put them in double quotation marks. So supposing we are searching for macular hole without putting double quotation marks around it, then I found that I could get something around 7,500 results, because it not only does it search about macular hole, it searches about macular as well as hole. So if I put the double quotation marks, about 3,000 of those results are eliminated. And so we get more relevant results. Third thing is to use truncation or use the asterisk. So there are instances when search on all the variations of a given word are relevant to you. And yet sometimes you cannot remember all the variations of that word. So PubMed simplifies it by using an asterisk after the selected word. So if you put an asterisk after, say, the word child, the PubMed will give you search results, not only about the search on child, it will also give about children or childhood. Also, you can use field tags like TI for title and TIAB for title and abstract. Now let us look at another group of things called key mesh words, which are different from the keywords. The mesh terms or the medical subject headings are used for indexing Medline records in PubMed, and they give a vocabulary that gives uniformity and consistency to the indexing of cataloging of medical literature. So actually, we know that there are different terminologies available for the same idea. So if we use only one term, we may be unable to get details of studies using those alternative terminologies. So mesh is a reliable way to retrieve citations that use different terminologies for those identical ideas, because it indexes articles based on the content. So when we click on an article of interest and scroll down to reach that mesh term part, we get a list of terms from which we can choose the term that we like and add to the search builder. So when we add to the search builder, we can get a comprehensive search. Plus, we can use multiple mesh terms for a given concept. So now that we have our keywords and mesh terms ready, we can go to our search history and combine the identifiers of a previous search. That is, we can combine, usually they are shown by #1, #2, etc. And so we can combine them to obtain a comprehensive search. And again, you have to add the Boolean operators between them. So that is why it is important to search with both mesh and keywords, because sometimes the mesh might not be available for your search, and sometimes the new articles that haven't been indexed are missed. So most of the times, the literature search is done by search of medical databases like PubMed or CDC Wonder or Cochrane database of systemic reviews. So when searching in these databases, emphasis should be given to the meta-analysis, randomized controlled trials, and the landmark studies. We can also look into the bibliography of the main articles that we have selected to obtain references for our study. PubMed also provides us something called similar articles when we click on an article of interest. And there are certain there is also a portion called cited by. So these are also, if we look into it, we can also get relevant articles for our research. Now I come to the second part of my presentation, and that is the reference management. In my early days, in order to include an article for my reference, I used to click on its title in PubMed and then go to the right side to click on Cite, and then a box appears in which the reference of that article would be there. Then I would format the article into whatever the reference format that my journal required, and then copy paste it into my Word document in a different color. So this is how my reference would appear in PubMed, in my Word document. So, but what I found was that if I wanted to move a reference from one position to another, or if I wanted to move my one paragraph from one position to another, then it becomes very, very difficult because I have to rearrange all these things. So that is the time when PubMed, and then these reference managers become very important. So these reference managers commonly available are EndNote, Mendeley, Zotero. I usually use the Mendeley Reference Manager and Mendeley Cite. So this, working on these, basically I have found that it is very intuitive working on the Mendeley Reference Manager. Previously, it was called Mendeley Desktop, but now it is Mendeley Reference Manager and Mendeley Cite. What I do is I click on an article of interest and then copy paste the PubMed index. This is the PubMed index into my Mendeley reference library. This is how my Mendeley reference library appears. And there I click on this Add New button, and then I enter the entry manually by copy pasting the identifier into this box. So when I click on the search button, all these boxes are automatically filled up by the metadata of the article of interest. So it's like this. And when I click add entry, all of these now become easily available into my Mendeley library. Another important thing is this notebook. In notebook, we are able to add the annotations and also tags to the references that we have collected. So we know that we can tag introduction for one of the references which we want to use for our introduction, or for discussion, another one. So in that way, we can use this. So when I'm writing a literature review or a manuscript, I click on the references and my Mendeley reference manager and my Mendeley Cite appears on the right side of my, my screen. And when I auto log in, all the references become available onto the on the screen. So it now is basically a very intuitive, very easy process. I just have to keep my cursor at the place where I want to keep the reference, and then click it on Add Entry. The best thing that has happened with the Mendeley Reference Manager is that it contains that insert bibliography. So even if you move your citations, even if you change your paragraph, now all you have to do is to press on insert bibliography, and then it will reset itself every time you change the order of citations. So now that big headache, especially since I became an editor and I found that I have to change the references or change the citations when people are giving the references, that has become very easy. Only thing you have to remember is to change the reference style when you are submitting to a different journal. So in conclusion, what I want to say is that the literature search is actually an ongoing process. Not only do you search for literature when you are writing the protocol, you are also searching for literature when you are writing the manuscript, when you are resubmitting the manuscript to a different journal. All of these times, it has to be updated. Thank you very much for your kind attention.
Thank you, Smita. That was really very nice. Very practical talk. Sunny, do you have any comments as to which reference manager would you prefer? Which one is free? Which one is paid? Anybody else for that matter? Any of these speakers?
So I personally use Zotero, but any of these are all pretty good actually.
Mainly, I think it's paid, ma'am, right? I also prefer Jotaro because it is free.
Mendeley site, sir, is not paid, sir. Mendeley Reference Manager also is not paid. It is free.
With Jotaro, I find one thing advantageous is you can create a group and all of you can share the references. While that is important while writing a review article.
Or maybe when you're collaborating with multiple. Yeah.
So one good thing which has happened with Mendeley is that now it has been taken over by Elsevier. So it sort of integrates slightly better, and you can form groups with Mendeley as well. And also most of these for people who want to do it for more number of publications, they have a general limit of 2 GB. I mean, because you're going to import papers into that. Once you cross 2 GB, which is like a lot. But then, I've crossed it in like 6 months. But then, so if you need more space, you need to pay. But as of now, most of them are free. Elsevier has made Mendeley slightly better, more intuitive. So it's, I think, now at par with Zotero.
Thank you, sir. Now I request Dr. Deepak Mishra to present about the type of studies. Dr. Deepak Mishra is an associate professor at the Regional Institute of Ophthalmology, Institute of Medical Sciences, Banaras Hindu University. He is a prolific author and reviewer and also a guest editor in multiple national and international journals and books. He is also the honorary secretary of Varanasi Ophthalmological Society and chairman scientific committee of the UP State Ophthalmological Society, and also the joint secretary of the IS-MS-ICS. Over to you, Dr. Mishra.
Thank you, ma'am, for wonderful introduction. First of all, I would like to thank Santosh sir for giving me this opportunity, and the office bearer of Kerala Ophthalmic Society and KJO for this opportunity. Is my slides visible? Yeah. Thank you, sir. There is no financial disclosure in this talk. First of all, what is study design? Whenever we refer to something like this study is this study is that. So in this simple word, we can say that study design is something just like a method or the collection of ways by which we can say that we can collect and analyze the data. So these two words is very much important, that in study design, we have to follow some procedure and methods by which we can collect and analyze the data. And what is data? Data is simply when we say that if anything is written in a number 1, 5, 7, 8, anything, and when we arrange them in a specific manner, either increasing or decreasing order, then these data can be which we can measure. So if we can measure anything, then it is a quantitative data, and if we cannot measure, just grade them in different scenario, then it is a qualitative data. So from understanding of study design, start whether that we have whatever the study we plan, did we give some exposure or assign exposure to that study? If a study is being assigned some exposure or anything, then it is termed as an experimental study. And if it is not decided or giving any exposure, then it is an observational study. So like we have seen this study, here what happens, we have compared the effect of IOP lowering drugs on an open angle glaucoma fresh cases. So we given some exposure, means anti-glaucoma treatment or the drugs we have given them act as an exposure. So these exposures will help us to assign them whether it is an experimental study. Then this experimental study again divided into two parts. One is either when we select our patient or the data, then it is randomized or not. Randomization means to avoid any type of biasing or anything, we randomize. Means if we have suppose two groups, B, A and C, and we cannot fix by our own choice that this patient goes to group B, this patient goes to group A, and this patient goes to group A. It simply means it is a randomized study. Okay, so from here we can say that it is a randomization is a part of a study. Next is like we have similarly seen that the same study has been randomized into 4 groups, and here you have mentioned. So randomization can be done in the study which is an experimental study just to avoid the biasing. Now there is an example of non-randomized study. Like here you have seen what we have done. We have done only the use of fibrin glue and the conjunctival suturing for a pterygium surgery. It means we have not assigned anything. Any patient can be glued after cataract surgery, or any patient can be sutured after cataract surgery. Here we not randomized, so it is a non-randomized group. And if anyone wish to read what is the real meaning of randomized trial or the non-randomized trial, I always suggest everyone to go to the IJO page, and here IJO has written wonderfully all the instructions for all the types of articles. So these articles which comes under the original article, you can go and read one by one, and you can find out that if exposure is given, what is randomized control trial, what is the non-randomized control trial. Now coming to the second group, in which there is no exposure or no treatment is assigned to the patient before or the subject before start of the studies. These can be divided into 2 parts. One is the anatomical, analytical, and another is descriptive. Like here, what we have done, and we have to remember that if there is any comparison group in it, means for an analytical study, a comparison group is necessary, and in the descriptive study, no comparison group is required. Like look at this article. Here, what we have done is only whatever the effect we are doing DCR surgery, but either by the conventional method or by the power implant. So here we have created 2 groups, means there is a separation between the groups. That's why it comes under the analytical study. Here, what happens in this study, you can see that the role of cyanoacrylate glue in corneal ulcer. Here we not divided the corneal ulcer in any grade. If you divide that role of cyanoacrylate glue in mild, moderate, or severe corneal ulcer, then this simple descriptive study is converted into the analytical study. So here is no comparison, means only you use the glue and find out whether glue is effective in corneal ulcer or not. We not compare this study with any another group. Sometimes and for that you have to use a proper verb. That is the important thing which most likely the editor or managing editor can catch every time, that if your study is a descriptive study, then at least write in your aims and objective, or sometimes in your title, this adverbs, means estimate, study, or describe is the common adverbs used to describe the descriptive study. And if it is an anatomical study, means in which there is a comparison group, then you can determine, examine, or compare. These things you can use in the analytical study. Again, descriptive study is divided into 2 parts. One in which the study population is, study element is the whole population. These are basically the ecological studies. And if it is an individual, then it can be the case report, as Santosh sir already mentioned well about that. IJO is having a case report journal. There may be a case series and cross-sectional survey. I will give example of one by one each. Case report is something which is a rare or new thing in the literature, or what we have find a new finding, or sometimes it is managed by a unique way. So it is important that a new cases, and usually the number is less than 3. We have to remember that if in the case report number is less than 3, you can have one case or 2 case or 3, then it comes under the case report. Like this is a case report in which we have reported an unusual post-axial polydactyly associated with retinoblastoma. Some journals just want the case report in such a way, it is in European Journal of Ophthalmology, just they have some gradation and abstract is divided into 4-point abstract 2. And some journals want publish this case report as a brief, in which you can publish it in a brief, like writing one by one all of the features, and you can write each and everything. Case series is something in which you have a common disease or findings in usually 3 or 10 cases. Somewhere it is written as 3 to 10, somewhere it is written 3 to 7. So case series is the same thing, just like the case report, but when you have the same type of findings or the situations matching you reported in a consecutive 3 or 4 cases, then you can publish it as a case series. Like here we have published a disseminated cysticercosis in children. There is a collection of 4 or 5 same type of findings and in the children. Now the cross-sectional survey. Cross-sectional survey is again something which you can use as a target population, but the main point is it is at a single point of time. Means at one time you can do, just like you can do any survey, or even you have prepared some questionnaire or anything and give it to mob or anyone, and they fill it and you find out. The advantage of it is that it is very cost effective and it can estimate the prevalence of disease. Like you have seen this article is published in IJO. Here we calculated the impact of COVID-19 related lockdown during the ophthalmic training programs in India, a survey outcome. So at one point of time, we send the questionnaire to whatever the residents are available with us. And in one questionnaire, you can find out in one survey how much their PG teaching is affected, how they spend their daytime or the activity, and what is the effect of lockdown on financial or the physical activity. So these type of studies, you can include it in a cross-sectional survey in which even at one point of time, you have to calculate each and everything. Now coming to the analytical study in slightly more detail, sometimes it is again divided into 3 parts. One is the cohort, in which the exposure already, we move from the exposure to outcome. Here we give some exposure and find out its result later on. Like if you are giving some vitamin A supplement to anyone and find out what is the level of raised vitamin A of these serums are in aqueous, then it is in, means we started treatment first and outcome is later on. A case control study, here what happens, we move from outcome to exposure. Here outcome is already happened and we are trying to find out what is the reason for it. And sometimes that both we evaluate at the same time, it again comes under the cross-sectional study. Like here, in case of case control, here you can see that both exposure and outcome is already known and we are moving in a retrospective direction. Means the result is with us, we are going in a backward direction to find out what is the effect of cause on it. Like the one of the famous example is Bhopal gas tragedy. If we are going in a backward situation, means in our history, to find out what is the effect of that Bhopal gas tragedy on eye, we find out, and if we correlate with that these effects in eye is related with Bhopal gas tragedy or not, then it is an example of case control study in which we move backward. But in a case of cohort is usually known as a prospective study. Here we move from cause to effect, means if we are giving anything and we are moving to move what the result it will happens. I'm showing with few examples, but before that I'm giving same thing, that you have to know that the case control study starts with the disease, most important, and it is good to study when you are planning some rare disease or disease which is not very much common, but there is always a chance of biasing. These 3 things is very much important to know about the case control study. Like this is a study that we have done, that what are the causes of blindness in the applicant applying for blindness certificate at tertiary care center. Means when the patient came to us or the recruits came to us, they already have some percentage of blindness. We are moving that what is the reason for the blindness. In this study, we find out the cause, means going in a backward direction, that if anyone is having a low vision or blindness of 30%, 40%, whatever we consider, then what is the cause for it? Means blindness already happened, our disease is already with us, we are find out the cause. So this type of study is known as retrospective study. And cohort study is something, it involves the larger, and it usually start with the risk factor. Whatever the risk factor we have given, we can find out, yes, if we have given someone ethambutol today, and we can find out that whether what type of optic neuropathy or its effect on the optic nerve we can see on later on. This is known as the cohort study. Now the cohort is again divided into the prospective and the retrospective. Again, I am saying prospective study is something in which the outcome of disease has not occurred, means we have started with the initial treatment and we didn't know what is the outcome. This is the example of a prospective study in which we have to assess the short-term and long-term effect of intraocular pressure lowering effect of anti-VEGF. So here we start with the treatment of anti-VEGF and find out what is its effect on IOP lowering in future. This is an example of prospective study. At present, we didn't measure or go for the intraocular pressure, whether it rise or low at present. So we have some baseline IOP here. Baseline IOP is measured here. We give an intravitreal injection and then find out whether what is the change in this IOP. So our outcome is the change in IOP, which we can measure in a future. A retrospective study, yes, retrospective study is same. I have mentioned you there. And here is an example of retrospective study. This is our article published in IJO. Here what we have find out, what is the validity of percentage tissue alteration, whatever we have done in the LASIK or the post-LASIK patient. So already the treatment is done on that patient and we are find out after the treatment. Means it is a retrospectively we analyze that we already done the treatment and now we are find out that what is the percentage of tissue alteration which we can match with the formulas or anything. So this type of study is known as retrospective study. Sometimes a cohort study can be a combination of prospective and retrospective. Like here we are seeing or find out a patient having something related to alcohol use, and he is consuming alcohol since 1970, and we started this study in 1990 or 2000 and completed in 1995. Or we can say from the current scenario that we have given calculated today in 2022. So the study duration of our is from 90 to 22, means this 22 years, but he's consuming alcohol since 1970. So anything from here to here, this data is retrospective, and from our consumption study, it is a prospective. So for chronic addiction or another thing, we can have a data in which the study can be prospective and retrospective both. So just for the summary, I have prepared this chart. This is from my book. Here, whatever the epidemiological study is there, it may be descriptive. I have already mentioned case report, less than 3 cases, case series, more than 3 to 10, and cross-sectional or preventive prevalence study. And the analytical study, again, if we go for the analytical study, then we have to know that whether this is an experimental study or the descriptive. Descriptive is divided into case control and cohort. And again, I tell you that cohort may be prospective, retrospective, or both, whatever we can say. So with these concepts in mind, I hope whatever we are using, use a proper verb for experimental and descriptive study, and understand that your study is prospective, retrospective, or both. Whether this descriptive study can be a case report or case series or another thing. With this, a take-home message is that proper selection of study is very much important. If anyone unable to understand his study, must take help of a biostatistician to understand what is the type of study he is planning. And it is very much important that you plan your study design before writing of your paper or taking your study, so that it's clear that you can have whole concept in your mind. With this, I would like to thank everyone. If any question, my email and mobile number is here. Thank you, sir.
Thank you, Dr. Mishra. Next, I call upon Dr. Neena to tell us about the power of a case report. Dr. Neena is the HOD of Pediatric Ophthalmology, Strabismus and Neuro-Ophthalmology at the Giridhar Eye Institute, Kochi. She has been a winner of multiple awards at KSOS Drishti, and most recently, she won the Prem Prakash Disha Award for Best Paper in Strabismus at the AIOC Mumbai. Over to you, Dr. Neena.
Thank you, Dr. Smita, for those kind words and giving me an opportunity to be part of this wonderful initiative, KSOS-IJO. So my topic has been the power of a case report. Am I audible to all?
Yes, you are audible.
So I'd like to start the slideshow. Is it moving? The screen is moving?
Not yet.
Not yet.
Okay. So anyway, so I think it's stuck. Yeah, I think it's moving now. Yeah. So what is a case report? Now, already people have described in detail the type of studies, and an idea about the case report has already been given by Dr. Mishra. So I'll just touch upon some important aspects. It's a way of communicating information to the medical world about a rare or unreported condition, feature, complication, or intervention by publishing it in a medical journal. So why should you give so much importance to case reports? Because case reports are time-honored, important, integral, accepted work. It's firmly established in medical literature. And some of the famous diseases were first described in the case report format, like Parkinson's disease and Kaposi's sarcoma. And if you see this description to the right of the PowerPoint slide, you can see that this is a description of a dislocated jawbone, which was published in the Edmund Smith Papyrus, dated as Bacchus 1600 BC, which almost describes it in the perfect way one would do today also. So why should you report a case? This is because as doctors, we treat patients and not diseases. We should always note and record the unusual, and publishing it puts it on a permanent record, and such communications are of great value, not only to your peers, but to the future generation. So to my right, this is one of the CDC's first report of what came to be known as the acquired immunodeficiency disorder, or AIDS. Again, as a junior ophthalmic professional, or someone who's going to start writing a case report, what is in it that attracts you to it? It's the first line of evidence in medical literature. It's a great opportunity to develop your writing skills, and getting a case report published certainly looks impressive on any CV. So before you start writing the case report, you have to look at some guidelines. So International Reporting Guideline for Case Reports, or CARE, consists of 13 primary items to be enlisted as a checklist before you write a case report. So this includes title, keywords, abstract, introduction, patient information, clinical findings, timeline, diagnostic assessment, therapeutic interventions, follow-up and outcomes, discussion, patient perspective, and informed consent. So this roughly gives you the stages in writing a case report. You have to find a rare case. You do an ample literature search, collect information related to the case, including consent from the patient, summarize and write it up, and revise and edit it. So this is a format for writing a case report. It has an introduction, then the case report, the real story, which includes the history, clinical features, investigations, treatment and outcome progress. Discussion should include review of literature. You should put in arguments, say a new message that you want to convey across, recommendations if any, and finally, references. So now, where do you find such a case? For somebody who's beginning to start a case report, you have to keep an eye out for the unusual cases. So if you find an interesting case, you discuss it with a senior consultant first. For all you know, consultants have stacks of unpublished material and are just waiting for an enthusiastic junior to help them write it. So as Dr. Smita already described, you have all these, platforms to do ample literature survey like PubMed, Medline, Ovid, Embase, and Google Scholar. So when you do this literature survey, you also improve your understanding of the topic, and it gives you an idea, or it helps you to develop the unique message that you want to convey through the case report. And by reading all this literature, you can even educate yourself with the latest evidence in that particular topic. So how to start writing the case report? So once you identify the case, you seek permission from the consultant who's in charge of the patient's care in case the patient is not yours. And obtain patient consent, because this is very important and a prerequisite for most journals. And most journals will ask you to download the consent form and get it completed along with your report. So you collect and combine all the information. You record all the key points from the history, including the examination findings, relevant investigations, treatment details, and outcomes. You ensure that you anonymize all the pictures and remove all the information which may identify the patient, and save all this onto a computer or on USB stick. And how do you finally write it up? So first, I would, as already mentioned, please read the journal's instructions before you start writing it up, because most of them will have word limits and you have to adhere to the word limits. And most case reports are not going to be very long, so you have to make it rather crisp and short. But start writing it in one stretch so that you can include all the details, whatever is relevant in the case report. Later, you can edit the discussion and trim down the article. So to summarize, case report should have these 5 important sections: abstract, introduction, presentation, discussion, and conclusion. So the abstract, now it should summarize the case and its clinical relevance. It should clearly state the subject and educational value of the case. This is because it will introduce the readers to the central theme of the article, and you should do this the last after you write the entire text, because then it's easier. Now, introduction. It should be concise and immediately attract the attention and interest of the reader, provide important information of case report, background, epidemiological data, and novelty of the case report, mention how rare this case is and why your case report is important in the introduction. So now we come to the case presentation part. You describe the patient story in chronological order. That's an easy and enjoyable way for the reader to understand, but in enough detail so that the reader can establish the case's validity. So the general approach is to describe the history, examination findings, investigations, and treatment in that order without the headings like in a textbook. But remember to include the patient demographics like age, sex, race. So when you're going through the case presentation, you avoid any unnecessary details, but you should mention the important positive and negative findings from each part of the clinical assessment. Also include 1 or 2 images so that the reader keeps his interest. Now coming to the discussion, which is the most important part of the case report, because this is a selling point of your case report. You start by expanding on your introduction and explaining why your case report is important and of interest to the reader. Some of the current literature which is associated or related to your case, describe what is already described about the topic, what are the main hypotheses and theories that explain the clinical findings, and come to the description of what message that you want to convey through your case report. This may be in tandem with the current line of thinking, or it may be even contrary to the popular belief. Focus on the lessons that you've learned from the case report in this particular regard and how this is going to affect the future clinical practice. So in a nutshell, you should summarize the essential features of the case report in your discussion. You should evaluate the patient's case for accuracy, validity, and uniqueness. Compare and contrast the case report with published literature. Derive new knowledge. Remember that reviewers will be looking for evidence that your case report is unique and rare. and a well-written argument will convince the journal that your case report is worthy of publication. So coming to the conclusion part. So it should be brief. It should be based on evidence which is reviewed in the discussion section. Emphasize the applicability of a case report to practice. Stress on the insight which is learned from the case. Suggest further action based on the case report. Should you have heightened vigilance? Should you avoid this particular way? Or should you further study before taking new action? Or are you recommending new ideas for further investigation? So that should be part of your conclusion. Some journals will also ask you to have a summary of key points in your case report. So whatever is there, you can summarize as 3 to 4 bullet points as key messages. And finally, you should have your references. So now coming to the important part, title. How to choose an interesting title. This is very important because many readers will screen articles just by looking at the title. So important thing is to have a catchy and interesting title and develop it only after writing the whole text to see what you want to convey is in the title. The value of a case report is its teaching point and its novelty and uniqueness. Focus on why the case report is important to the reader, for the publisher, and focus on who's going to read it. Now coming to references. So this has already been described, but you read the instructions given in the particular journal and list the references in the style which is requested by the journal. And case reports don't usually ask for more than 10 references, so remember to keep them short and relevant. Now, how many authors should you have in a case report? Not many. This is because I should only list the people who are directly involved in writing the case report, including the consultant or colleagues who've contributed to this. And you have to finalize who's going to be the first author and the corresponding author. So submitting your case report. Now, before you submit, make sure that you proofread it. Spelling and grammar should be checked. Make the final revisions and write down the covering letter. So be prepared for rejection, revision, and acceptance. And remember that you cannot submit your article to a second journal while awaiting a decision from the first. But remember that persistence often pays off, and you have to be patient, persistent, and perseverant. So this sums up the steps in writing a case report: search, sort, summarize, read the fine print, proofread, write clearly and logically in the whatever that you want to convey. And finally, it is a teamwork. Now, already this has been mentioned by Dr. Santosh, but I'll just touch upon some important things. So when you're submitting the case report, you have to choose the journal wisely because most of the established journals don't publish case reports. But the good news is that, as I mentioned, most important journals have a companion case report journal. But remember, if you want a wide readership, you look at the indexing of the journal, see the impact factor of the journal, and also, most importantly, find out about the publication fees, whether you can bear it or not. See if you have institutional support, because that makes things easier for you. So finally, case report gets accepted. It's celebration time, but you have to keep your eye out for the next interesting case. So these are my references. Thank you.
Thank you, Dr. Nina. As usual, you have been very precise and very clear. Really appreciate it.
Thank you, ma'am.
The next speaker is Dr. Chaitra Jayadev, who shall be speaking on how to write an original article. Dr. Chaitra is the head of Vitreoretinal Services at the Narayana Nethralaya, Bangalore, and she's a joint secretary of the AIOS and VRSI and chairperson of the Scientific Committee of the Karnataka State Ophthalmic Society. She is also a recipient of the J.M. Pahwa Award for the best paper at the annual conference of VRSI. Over to you, Dr. Chaitra.
Thank you, KSOS and Dr. Santosh Hanawat for having me in this webinar. It's a pleasure to be part of this, and there's some amazing work being done by KSOS. This is not their only platform. I think they have such regular academics that's going on that I wish we all could do the same. So congratulations to your entire team. Today I'll be talking about how to write an original article. I think The previous speakers have covered all the other pertinent topics, be it writing a case report, the study design, and what is the importance of publishing. Let's look at one of the most important types of articles that you may need to write, not only to convey your research, but also required for a lot of other career advancements one might need. I have no financial disclosure. So in science, the credit goes to the man or woman who convinces the world, and not to the man or woman who the idea came to first. So I might have an idea, I will tell it to 10 other people, but that doesn't let the world know. The same thing, whoever heard my idea, if they manage to put it on paper and publish it, 10,000 other people could see it. So this is what Dr. Hona was talking about, leaving back your legacy. Even after you go, whatever you have published, whatever you have tried to convey will remain for the rest of your life. So why publish? Most of it has already been covered. What do you want to publish? That's new and original, that are reviews or summaries of a particular subject, or manuscripts that advance the knowledge and understanding in a certain scientific field. And for us, it's ophthalmology. And what not to publish? Reports that are not of any scientific interest, out of date work. You don't want to write something that interests nobody. Duplications of previously published work, either by yourself or by someone else. Incorrect or unacceptable conclusions, which one might want to submit just for the sake of publishing an article. Now, even before you start writing your research, an early decision that you need to take is whether you want to work alone. By working alone, you learn from a lot of rejection letters and from harsh peer review, but you get individual glory. This is a little difficult, but we do have authors who are single, in their papers, which just goes on to show that they're such great authorities. But you may also want to team up with colleagues. This is better when you're starting off, your writing career. You team up, they're critical and they're supportive at the same time. They read and comment on your papers. It's quicker and more efficient because somebody is more skilled at one thing compared to another. Now, even before you submit, I think some of these points have been covered. Check the journal specification and tailor write it to fit that, because it's very difficult to redo it completely for a different journal requirement from what you wrote. And specifically also for the references, each journal wants it in a certain way. So you may want to start off writing for that particular journal. Enter the conversation of an ongoing topic in that journal. See what others are publishing on your subject in that particular journal, and it helps you to prepare. Read a recently published article or an original article. That helps even further. So what is the type of journal? Whether you want to send it to a general or a specialty journal. Like IJO is for ophthalmologists, but it's more general. But if you want to send to a specialty journal, you may want to send to retina or to glaucoma. So these are all specialties in which you are working. Whether you want to send it in basic science research, you want to send it to a peer-reviewed or a paid invited contributor. There are society journals as well. Sir has already spoken about it. Yeah, ARVO has conference proceedings as well. So these are some of the other journals. Industry sponsored are there. When you're selecting the right journal, look for whether it's a research or a clinical journal, whether it's a general subspecialty, or you even have super specialty or subspecialty articles and journals, whether it's surgical, medical, animal versus human studies, emerging versus the regular studies. Now, going on to writing an original articles itself, I'm just going to give you the different parts of a scientific paper: this title, an abstract, an introduction, the materials, the method, and also the results. Finally, the discussion, which interprets the findings of the study, the summary, the acknowledgement where you have to give credit, the references. So now, what is the first thing an editor actually looks for? The cover letter is crucial. Most of us tend to ignore the importance of a cover letter and we copy paste it. Don't waste this opportunity to sell your work. You have to tell the editor why your work is important, why is it different, and what does it add. Don't write something like dull and derivative. I have also written something like this. Please consider this manuscript for publication in your esteemed journal. I have written this several times. Do tell the editor why they should take your work seriously. Give a brief description about what you set out to do and what you've accomplished in your study and how it adds to literature. What is the second thing an editor looks at is the title. Make it very, very compelling. It should be concise and informative. It should contain the most important words related to your topic. Entice the reader without giving away the punchline. not overly sensationalize it. I'll show you some examples. And some journals now insist on including the information about the study design as well. So look for the instructions for a particular journal and make sure you include all that in the title. Now, a bad title is something like the amazing effects of a bed net on malaria. Now, this is not a tabloid or a magazine you're writing to. You're writing to a scientific journal. Instead, you put on something like a randomized controlled trial on the efficacy of insecticide-treated bed net used for malaria control. So this will give you not only the type of study, it will tell you what was the intervention probably, what is the disease under consideration. So it is very concise, but at the same time, it's giving a lot of information. Now, titles of editorials or commentaries. The bad titles would be something as vague as a doctor in a fraud case or stress in doctors. Instead, you can write like, doctor convicted in a 4 million fraud case, or stress levels in doctors so to a new high. So this is something that somebody may actually want to read because, it will pick their curiosity. And editorials and commentaries, if you can put a verb in the title, it's always very effective. What is the third thing that an editor looks at is the abstract. Many journals now base the decision on the abstract alone. They want to see what you've been able to fit in that 250 or 350 words that can convey. Because, when you go into PubMed and you're searching, what most often you can get in 90% is the abstract. And many readers also, besides the editors, will actually
want to look at how many, sadly, however, many authors write the abstract in a great rush. They don't give as much importance. It's almost written as an afterthought. That is not done. It should be a standalone piece with a very, very clear message, and it must accurately reflect the full text of the paper. So even without actually reading the full text, without somebody having to actually pay for the full text, you should be able to get everything in the abstract, and they may want to buy your article when there is no.
Now, why did you do this? What did you do in the study? What did you find? What did you conclude? All that should be fit into the abstract. Now the introduction. Grab the reader's attention. They should be drawn immediately to the crucial issue that your paper addresses. Keep it short, just 2 to 3 paragraphs. You can't write long drawn paragraphs. Nobody will be interested to read that much. Avoid a literature review here. Set the scene, give the state of art rather than describe everything you know about the topic, because that's not required. Tell the reader why your research was needed. Why does it matter to the doctors or the patients or to policymakers or to researchers? Were there any controversies that you were trying to address, and what did you do that was new or innovative? Otherwise, it doesn't make sense in even publishing that paper. But don't give away any of the results or conclusions in the introduction. Opening sentence, like an opening batsman, takes you straight to the issue. Hit a sixer if you can. Contain the most important details of the issue. It should contain a brief summary of the controversies and the best evidence, and ends in a crisp and clear research question and how you set out to answer it. You should keep with the rules of good writing, and it's written using active rather than passive tense. Now, next, going on to the methods, I'm covering it as IMRAD, which we're all very, very familiar with. It's an extremely common for editors to reject the paper because authors use the wrong methodology to answer their question. This should be very, very strong. Give enough details so that a qualified reader should be able to repeat the study. Again, you should give all the nitty-gritties of how you undertook your study so that every methodology is covered there. You should, if your methodology is thin on the details, editors worry whether you've actually hidden something. So again, you should be very, very careful. Don't give rise to any ambiguity. Make sure that the smallest of details is covered here. Especially for quantitative studies, the editors will focus on 6 things: the design, the sample, the intervention, the outcome measures, the data analysis, and the ethics, whether an informed consent and an IRB approval was taken. I think some of it will be covered in the subsequent talks as well, so I'll not go into too much of the detail. Walk the editor through by dividing the methods into these 6 subheadings. You don't actually have to probably list them out, but if you can cover all of them, you'll ensure that you've left nothing out. Now, the design, you have to state clearly the design used, whether it's observation or intervention, whether it was prospective, retrospective, controlled, uncontrolled, if controlled, whether it was randomized or not, And for RCPs, how exactly was the randomization done? What was the unit of randomization, and was it a cohort, a cross-section, or a case control study? Biological samples, how did you choose them? How did you determine your sample size, include the power calculation? How did you recruit your participants? How did you ensure that your sample was representative of the population that you wanted to study? What measures did you use to reduce bias, and what were your inclusion and exclusion criteria? Again, all very, very important. Now coming to the results, the facts and nothing but the facts are important. Should be ordered around the primary and secondary outcomes in the same order as listed in the method. State clearly and simply what you found using words and numbers. No need to be very descriptive in the results. Use tables and figures. Don't duplicate information in the text and tables. You restrict it. See, the whole idea of making it in either as text or tables is to make it concise and not repetitive. Going on to the discussion, don't write a big, huge essay that extrapolates widely what you found. Start the discussion with a single sentence that states your main findings. That is the most powerful way to do it, because nobody wants to read the entire discussion sometimes. They just want to read the beginning and see whether it's worthwhile. Discuss both the strengths and weaknesses. That's very, very important that you also list out the limitations. In depth, relate your study to what has been already found. This is important because you want to compare, what is there and what is already there, and you want to compare it with what you found. Next, discuss what your study means. Don't overstate the importance of your findings. Readers need to make their own conclusion. Unanswered questions. What did your research not address? Don't use any cliched sentence. We always tend to end that, more detailed or a larger number of patients are required to answer this question. Don't do that. That's very, very cliched. Editors, reviewers, readers, none of them like it. Avoid a long and rambling discussion. First paragraph should just cover interpretation, your supporting evidence. Subsequent paragraphs, you compare and contrast to previous studies, like I mentioned, your strengths and weaknesses, your any unexpected findings, especially adverse events, hypotheses or models that you want to make out of this. Your last paragraph should be a summary, the significance, unanswered questions, and future direction. References are important. It's already been told. Acknowledgments, you don't have to list everything, my parents, my patients, my hospital, my staff. No. Those who have had a significant contribution to your paper who are not co-authors. All co-authors don't need to be acknowledged, but you may want to acknowledge somebody, who's helped in a specific step of your study, which, do not warrant co-authorship. Your author contribution, who did what, competing interest, if any, funding that you received, and statement regarding your ethics committee approval. Sometimes even the approval number may need to be mentioned. Writing backwards. Most often people want to know where to start off with, the method, because that's what you've already done. It's very easy. Then your figures and tables. Why I put the second is sometimes without these figures and tables, the paper loses its worth. The reviewer asks for it and you don't have it, it doesn't make sense. So ensure that you collect those first and early in your study itself, so that you don't lose it and you don't go back looking for it and can't find it. Your results and discussion then your conclusions and your introduction, and last, very important, the abstract and the title. So some quick tips and tricks. The basics: avoid long words. Be concluded instead of it can be concluded. One or two complex ideas max in one sentence. Sometimes one entire paragraph is one sentence. When I'm editing papers for my colleagues and co-authors, it's very, very, the thought process gets so convoluted when you have so many ideas in one sentence. Short sentences, average 20 words, but never longer than 50. Cut out unnecessary adjectives. Avoid jargon. Short, simple words. Keep it simple. Avoid double negatives. AMD is not uncommon, not required. Dealing with word limits, very, very difficult. Eliminate meaningless phrases, superlatives, cut the least important bit. And if you still can't, meet the word limit, write again, because especially for the abstract, sometimes, you just don't get the flow when you're just cutting out the phrases. Common mistakes: holding back important information, including references in the abstract, wasting introduction sentences, using the same sentence for abstract and introduction. Please don't do that. It's poor writing style. What you omit is the ethics clearance approval, sample size calculation, the randomization method, and the blinding. Questionnaires need to be appended to your paper, your interventions done, the clinical assessments, and the statistical methods. Tables and figures, like I mentioned, avoid repetition. General rule, 1 table per 1,000 words of text. Resolution of images, please 300 dpi, otherwise it will be sent back. Don't use color unless absolutely necessary, because color processing charges are very, very expensive. Preventing fraud, I think I will just skip through these slides because I think Sabyasachi will be covering them. Patient consent, copyright. So editorial process, again, I'm sure it's outside the scope of this, but all these 3 are involved, and that's important. So let me skip the peer review process. Right, so last, the checklist to have a fighting chance. Focus, make a single point. Keep the methods and results pakka, that builds credibility. Like I said, if you don't do it, the editor or the reviewer thinks that you're hiding something. Include reviewers and editors' references. These are extremely important things because both the reviewers and editors like to know that you have read their work. You know, if you put 1 or 2 of their references, they're really going to know that you worked hard. So what, when, and what now? This is in Indian Pediatrics uses this. So that's a good way to conclude your paper. The reason why I've kept all the numbers is 1 is because all of them are extremely important. Now going on to the next few, don't put too many references in the intro. Evenly distribute over PMRC, have a strong conclusion. Let the paper flow as one story. Otherwise, there's no continuity. People feel like, as somebody was discussing this and the person has jumped to the next. It should not be like that. Not every piece of research is a paper. Every interesting case cannot become a research. So that you can probably send in as a photo essay or something simple. Don't cut the work too thin or salami slicing. Keep one paper and a strong journal, sends a strong message with rather than 5 smaller papers. Publish to enhance literature, so be honest. So this is my concluding slide. Research is like a camera. Focus on what's important. Capture the good points. Develop from the negatives if you're rejected. And if things don't work out, take another shot at a different journal. But remember to format it for that particular journal. Don't send something that you've written, including saying, dear editor, BJO, and send it to AJO. It's going to get rejected at the cover page stages, cover letter stage itself. Thank you so much and all the very best.
Thank you, Dr. Chaitra. That was wonderful. From a perspective of a medical college teacher, I think we encourage our postgraduate students to not only write case reports and original articles, we should also encourage them to write the letter to editor. It actually helps them to keep interested in other people's work, as well as they can see through the study and unearth the deficiencies very easily. And also they would be doing a bit of literature search before they would be writing the letter to editor. So that is my take. Would anybody like to comment on this? Or should we go to the next talk?
So I would like to comment on your letters to the editor. I think it's one of the simplest way to do it. And I'm sure your students are also aware. There are 2 ways that you can write letters to the editor. Some journals don't take letters to the editor, which does not pertain to an article already published in their journal. So they would only want you to comment on something that's already published there. But IJO takes, simple letters to the editor where you may just want to discuss a point of ongoing, some controversy regarding medication that we're using or something interesting that you've seen in your OPD. So like Dr. Smita said, I think it's one of the easiest way. You don't need to do a PMRC. You don't need to pay for color processing, but it's still there on PubMed. So it definitely adds to your CV, and it's the best way or the easiest way to start off.
Thank you. So next I invite Dr. Prafulla Maharana to speak about writing a review article. Dr. Prafulla Maharana is an associate professor at the Dr. R.P. Center for All India Institute of Medical Sciences, New Delhi. And he's the chief editor of Ophthalmology Clinic's book series and also the editor of DOS Times Keratitis. Over to you, Dr. Maharana.
If my slides are visible.
Yes, sir, your slides are visible.
So thank you, KSOS and Dr. Honabar, sir. So indeed, Dr. Chaitra will agree with me. Since last few weeks, we are doing this research methodology webinars at too often time. But it's always a pleasure to share something that you have experienced during your publication journey. So most of my part has already been covered. Method of literature that has been covered. Type of study that has been covered. How to write introduction and what all things that you should keep in mind while analyzing a study, that has also already been covered. So I'll just go through a few of my personal experiences while writing review article. So briefly, what is a review article? Dr. Deepak covered it excellently. So in a review article, what you are doing is you are doing basically a literature review on a specific topic on existing research materials. Okay, you are not doing anything new. You are just analyzing whatever that has already been there in the literature. So just few points to differentiate from my original article. So here you are deciding a particular topic and you are assessing what has already been done. And the format, the classical format for an original article is IMRAD, or Introduction, Method, Research, Result, Analysis, and your discussion part. But in review article, the format is a little bit different. Here, the abstract would be brief. The method of literature search is very important for specifically for the editor point of view. The discussion part is has to be elaborate. You have to do a lot of analysis, conclusion, and you have to give a future trend about that. So why review article is important? So before that, I'll just highlight what Dr. Deepak Mishra highlighted, that a review article can be two types. One is narrative, the other is systematic. Narrative is what most of us are will be doing at the early part of your career. So my focus will be primarily on narrative type of systemic review. Systematic review, that includes two types. One is qualitative, the other is quantitative. Qualitative is this classical systematic review where you take all the studies, you analyze the data, but you don't do any analysis. Quantitative is classic example of meta-analysis. That what it does is it not only collects the data, but it also do further analysis using statistical methods. So these are the two advanced form of reviews. And as Dr. Smita highlighted, they carry the highest value in terms of the evidence. So these are the best type of review that you can do, but you need a lot of expertise and a huge team to do that. So why review article? For me, the most important part is it gives you a complete understanding of the subject, not only for the person who is writing the review, but also for the readers. It gives you a complete understanding. It identifies the research gaps. I'll just show you one example of one of my articles. And in fact, all of us, whoever has done a thesis, we all know the moment we get a topic, the first thing that we do is we search for some review article on that topic. So often a review article is the first point of starting a research. And also it helps you in establishing a problem statement. And lastly, it derives novel conclusions. For example, 10 original paper, they might have come out with 10 different findings, but when you do a systematic review, you may come out with one unique finding. So these are the advantage, these are the plus points of a systemic review. So this is a review on mycotic keratitis pharmacology therapy. We published in Survey of Ophthalmology in 2019. Most of my discussion will be based on Survey of Ophthalmology because I consider that is probably the best review article, review journal that we have in current times. So here, as I discussed what a review article does. So the precedence to this article was that in 2019, it was mycotic ulcer treatment trial that results were published, and all wherever in whatever conference you go, be it national or international, that was the guiding point. So we thought, let's review what else is there. So this on left side, you can see these are the 4 pages of that review article where we analyze almost 50 plus original papers. And the mud trial, what it suggested that the role of voriconazole has no role in fungal keratitis. But on the contrary, when we reviewed the other article, what we found that no doubt natamycin is the drug of choice, but topical voriconazole is an alternative. It's not that it has no role in mycotic keratitis. Similarly, the mud trial, they suggested that systemic antifungals are not recommended. But after doing a systematic review, what we found that systemic antifungals may not be recommended routinely, but whenever there is scleral involvement or there is a perforated ulcer or there is endophthalmitis, they do have some value. So the point that I am trying to highlight here is original paper, they can give you a narrow idea, but when you do a review, it broadens that idea and it gives you more new thoughts about that subject. Similarly, future challenges, as I said in all the review articles, there must be a section of future challenges. When we reviewed all the article, what we found that mud trial is the article that is from India and one center from US that is being followed all over the world. But there are no well-controlled studies from other parts of the world which have highlighted that the lack of well-controlled trial from other part of the world is disappointing. Then we concluded that in bacterial keratitis, although culture sensitivity is a routine, but in keratitis, it's rarely being done. And in future, this could become a routine practice. So all these points, what I'm trying to suggest is that if you write a review article, good review article, you may give an idea that researchers can carry forward and do some future studies. So part of writing a review article, I think there are 3 stages for me. One is preparation, second is execution, and third is review. The first part, preparation part, is very important for a review article because it decides whether your article is going to be published or not. Execute writing part is important, but that can be corrected during the peer review process. Review part is as important as preparation part, because if you don't do a proper review and submit the article like that only, then it's highly likely that the editor won't be impressed with you. So I'll cover this one by one. So preparation part, first, most important is please know the scope of the journal that for which you are writing. For example, these are the 3 major review journals that are there in ophthalmology currently. Also IJO and several others are there. But these journals primarily they deal with review articles. So in current opinion in ophthalmology, if you see, the first thing that they say is we only accept commissioned articles. So if without reading the author's instruction, you start writing a review article and submit it, it's going to be rejected. In Survey of Ophthalmology, if you notice, it clearly says before preparing the manuscript, first you have to submit a detailed outline to the editor-in-chief. If the outline is accepted, then only you go ahead and start writing your review article. So if you prepare a review article for Survey of Ophthalmology without taking consent from the chief editor, then all your work is going to be wasted. Similarly, for current eye research, also they accept commissioned article. The point here I am trying to highlight is Survey of Ophthalmology, they don't have any word limit. But if you see in current eye research, they have a word limit of 7,000 words, right? Similarly, current opinion of ophthalmology, they have some limits of 4,000 words and reference of 50. So please, before planning a review article, please decide for which journal you are attempting to write the review and then proceed accordingly. So identifying the scope of the journal for which you are writing the review article is very important. Second important thing is topic. As Dr. Chaitra highlighted, topic is the most important part of a review article. Why? Because the work has already been done. Whether it is relevant to the reader or not, that depends on the topic that you are deciding. So I'll just show you one email communication between me and the chief editor of Survey of Ophthalmology. For vernal keratoconjunctivitis, when we went through the literature, what I found that the last major review on this topic was in 2008, published in Acta Ophthalmologica. So what I wrote to the editor is that, see, in recent time, there has been a lot of changes in the new innovations in the pathogenesis of the disease. A lot of investigative tool has come up, and also the management approaches have been modified significantly. So we believe this article, a major review on vernal keratoconjunctivitis, may help your reader. And surprisingly, based on the simple logic, the chief editor agreed, and then we published this review in Survey of Ophthalmology. So identifying the topic is very important. Similarly, this is another review article that we published in Survey of Ophthalmology. Just to tell you briefly what the communication was with the chief editor. The article was about surgical alternatives to keratoplasting microbial keratitis. So what we highlighted that the first point of contact in the case of microbial keratitis is mostly a primary care physician. They don't have keratoplasty facility. So there is undue delay in referral that can have devastating complication. So what we want to discuss is we want to discuss all the surgical alternative to keratoplasty available to a primary care physician. So that will help them. So this idea, this topic Okay, that impressed the chief editor, and again we could publish another review article in this important topic. So the point I wanted to highlight is choose your topic carefully. Okay, so this is an example where you'll realize why topic is important, because again I wrote a review 2 years back, and I wanted to write a review article on pharmacotherapy of herpetic keratitis. The idea was that HEADS trial was there a long time back, and most of the treatment is guided by that only. So we wanted to review whatever the literature that was there after HEADS. But to my surprise, we were wrong, because what the editor replied me is that, see, there is an already ongoing multicentric trial, that is zoster-IJO study going on, and it's better that we wait till the result of that study is published. So this brings to this slide that when you are planning for a topic, don't think that, okay, this topic is interesting, so I'll write a review. Please do a thorough literature review about that particular topic. And for me, if you find that there has been some review article published within the last 5 years, then it's better not to attempt that topic. Better you choose some other topic that may be of some importance. Okay. The second important point is expertise. So I'll just give you one example. This is an article on review article on rare and emerging microorganisms in infectious keratitis. We published this in Current Eye Research, but the email trail that I'll like to show you is that, as usual, I wrote an email to the chief editor that this is a topic and these are the lacunae shortcomings. So we want to highlight, we want to write a review article on this. But to my surprise, the chief editor wrote me that, first send me your publication list. Let me see if you have enough expertise on this topic so that I can allow you to write a review article. So I had to send her my CV, all the publications related to this field. And to my, luckily the editor agreed that, okay, you people have enough publication to merit to write a review article. So we published that article. So when you are planning a topic for a review article, please choose something in which you have expert enough, or your mentor is expert enough. And second, do a thorough literature search. Don't try to write a review article on a topic on which there are already been several review articles. Okay. So the second important part is how to execute that. Once your article title is decided, topic you have decided which journal you are publishing, and the chief editor agreed, then how to proceed about. Okay. So check the journal guidelines first, check the word count, check how the referencing to be done, and all these things, please go through that first. Then method of search, I'm not going to detail of that because ma'am has already discussed how to search for that. Outline, this is the most important part for a review article. I'll show you one example of a survey of article outline. So make an outline, and that outline has to be detailed. For example, if natamycin is one heading, please write down the subheadings which you are discussing, on which you are going to discuss the natamycin, like pharmacokinetics, chemical structure, mechanism of action, side effect. Okay, so all these things you have to first put it into an outline. That makes your life very easy. Have a team. For original article, one person can do, but for a review article, you need a team. And at least you need 4 or 5 hardworking guys, because this article runs through 5,000, 7,000, 10,000 words, and the number of references includes more than 200 plus. So it's very difficult for one person to do that. Writing part, okay, so title, Dr. Chaitra have already highlighted what all things that should be there in a title. Abstract, don't ignore the abstract part, because in the review article, the abstract is not that important, but in the abstract, please highlight what is the gap and what you are trying to show in your article. Keywords are important because that gives more visibility to your article. Introduce the topic well. So introduction has to be brief, but you have to maintain a flow and you have to tell the reader what you are trying to do. Just to give you one example, introduction need not to be very lengthy, which Dr. Chaitra rightly highlighted. The famous article by Watson and Crick on DNA helical structure that got them the Nobel Prize. If you go through the article, you'll be surprised. The introduction contains only few lines. The first sentence says the structure of DNA is still not defined. The second line says that we are giving you a model of DNA helical structure. That's it. That is the introduction of an article that won the Nobel Prize to the authors. Okay, so introduction need to be brief and to the point. Report means what you are going to report in your review article. So if you see this part, report has to be discussed in a systematic manner, and try to use as much as tables and figures, not figures, but tables, specifically in a review article. Because if you are reviewing 200 articles, it's very difficult for you to write down what each an article says. So it's better to put them in one table and give an overview or summary of those tables to the readers in the manuscript. Okay. Always discuss the limitation and future perspective. Critical discussion, I'll just discuss that in one slide. So this is one example of how a survey literature search column looks like. This one is the paper. This one is from my paper of VKC. You can see we have highlighted which are the database that we use, which ma'am has rightly showed to you in the initial presentation. Remember, the more database you search, the more is the reliability of your finding. Then you can describe the terms, the keywords or the mesh terms that you use to search the article. Is this again improve the credibility of your article? And as Dr. Deepak highlighted, you have to tell them that which are the articles that you prefer. For example, here we preferred all the prospective studies and randomized control trial, but retrospective and case reports were also considered when they were found relevant. So this is how you have to write how did you go about the literature search in a review article. So this is an example of one of my article in Survey of Ophthalmology. This was the outline that we prepared initially. Then we started working on it. So if you ask different authors, they have different way of working on a review article. I have seen few suggest that first you collect all the articles and then make a table or make a summary of each article and then you start writing. But if you ask me, for me, first I like to make an outline, detailed outline, and then I'll divide this into 3 or 4 guys. So like if somebody will write systemic antifungal therapy, somebody will write on targeted drug delivery, somebody will write in recent advances, and then in the end we are going to club that. Okay, so divide it among your colleagues and address each section one by one. For example, if you are writing about this article, the first column suggests antifungal agents for mycotic keratitis classification. So first I will search all the articles about classification of mycotic keratitis. Then I will write down about that. Then I'll move on to the next section. Suppose my next section suggests mechanism of action of antifungal drugs. Then my search will be only using these terms as a must terms or keywords. Mechanism of action of antifungal drugs. Okay, so I'll use them using all those terms like and, or both, and then I'll write that section. So my approach is go section by section. Instead of reading all the 250 articles that you have cited and then start writing, please read 10 articles on mechanism of action and then summarize that. Then read 10 more on route of administration, then summarize that. So if you go step by step, then it makes your life quite easy. But yes, the authors may vary. And this is just to highlight, it's a teamwork. You cannot write entire manuscript, especially major reviews on your own. But if you see these survey articles, I have almost 3 or 4 authors. We are almost same. And there are seniors like Dr. Titial or Dr. Nanda Sharma, but I cannot ask them to write a first draft for me. So they are there to give you expert opinion. Okay, so whenever you are planning a review article, take some colleagues who can help you in writing the article, and do take some senior colleagues who can tell you, who can give you critical comments, whether it is good enough or not. Critical discussion, when you're writing a review article, for every article, this point you should mention in your report. First, summarize the article. Whatever article you are quoting, just tell what was the purpose, what they found. Then the most important is what are the strength of that article. For example, if the article is a randomized control trial, you can highlight this is a RCT, which is its strength. Weakness, suppose the sample size is less, then you have to highlight. Although it's a randomized control, you have to interpret the result considering a relatively small sample size. And remember, no study or no publication is waste or no research is waste. They do give you some knowledge. Please highlight that. Somebody has worked so hard for an original article. You highlight what is the knowledge that they are trying to give to the readers. And what about the gaps? If that study missed something, then please mention that. And lastly, take a standpoint of either supporting or not supporting. Give your opinion. In the end, you should write a paragraph that, in my view, or we believe that this article although say this, but these are the lacunae. So we have to look for future studies, or we can accept the studies. Okay, so this is the I've just taken to show you how a poor critical decision looks like. This was my first review article, clinical and experimental ophthalmology, and this is what I have discussed while discussing a outcome of BCL in recurrent corneal erosion syndrome. Okay, so I just mentioned that Ahad et al. They found that BCL has no extra benefit compared to lubricating drops. In fact, a complete resolution was achieved in higher proportion of cases in lubricating group, the percentage. Failure to respond was higher in BCL group, the percentage. Then the only advantage was this. But if you notice in this paragraph, there is no mention of what was the study design, what was the sample size, what are the limitation of the study. And in the end, I am not saying anything about what I believe, what I feel about the study. Okay, so this is how most of the review article, if you go and study, you will find this is how it's been written. But this is a wrong method. Whenever you are quoting somebody's article, you have to give your point of view and you have to highlight the plus and minus of that article. A few words about systematic reviews and meta-analysis. The narrative, in the narrative review article, you are not doing any analysis, basically. Okay, in systematic review and meta-analysis, what you do, you define your first, define the target, what you are going to, what is your study question. Once you have defined that, then you define the method of selection of the articles. Then you have to establish what are the articles chosen and why they were not chosen. Then you have to explain whether these articles are reliable, what is the level of evidence, and all this has been there in the PRISMA guidelines or preferred reporting items for systematic reviews and meta-analysis that you can go and read, because it's a very it's a 1 hour talk. So this is the latest that they have come up with. In 2007 there was an article, then in 2020 again it was revised. So this is there in BMJ. It's a free open access article, so you can go through this. Basically there were 27 checklists. Okay, so if you read each and every of them, then you get an idea that okay, this is how a systematic review or meta to be done. But even if you are writing a narrative review, there is no point, there is no harm in cross-checking this with the checklist. Although few things like analysis, data collection won't be applicable to your narrative review, but there are several things like objectives, eligibility criteria, how did you report, how the study was chosen. All this can help you in coming out with a good review article. Okay, so before last part is the review part. Once you have written a review article, the thing that normally you have been through the article so many times that you get frustrated and you say, okay, jo bhi hai, submit kar do. Please don't do that. What you can do is you can ask one of your colleague or neutral colleague who hasn't worked anything in that to go through the article again. And these are the things you must check, what the journal expects from you, and if your study is including all those things. If you have if your search engine include multiple websites, not only the single PubMed, if the overview is written nicely, if the discussion which I highlighted have been done in a critical manner, have you included a column about future suggestion? And lastly, please check, because review article is such a huge article, there are bound to be a lot of spelling and grammar problems. I use some software for that. You can also use that. And referencing is very important. Please use some automatic reference manager. Don't try to do manual referencing for a review article at least. So I hope this will help you while planning a review article. And as you write more and more articles, you'll get more and more experience and you'll become a perfect review article person. With this, I'll conclude this talk, and I'd love to answer any doubts if you have.
Thank you, Dr. Maharana, for sharing your personal experience, basically, which made it more interesting. We actually are overshooting our time. So now we come to a very important topic, a topic which breeds fear in the mind of editors and future editors, basically, and that is about publication ethics, or the decreasing standards of it. And now we have the right person to talk about publication ethics to us, Dr. Sabyasachi Sengupta, the current dynamic associate editor of the Indian Journal of Ophthalmology and the founder of the eponymous Sengupta's Research Academy. Over to you, Dr. Sengupta.
Thank you, Dr. Smita. So, I'm going to talk to you about publication ethics, and, it may be very interesting for the editors and, and people involved with the editorial process. But, let's understand that it's about 5% of us, 95% of your authors. So don't worry, I have your best interest in mind as well. And I hope that, I'll not take you through the mundane, but only show you some things that are really new. And, that hopefully this will be very interesting to you. So I think Dr. Smita has already introduced me, and this purely comes from having some editorial experience under my belt. And, so what I'm trying to really throw light on on a topic is slightly uncomfortable, isn't it? Because nobody, I think, cheats. Nobody cheats willingly, isn't it? It's sometimes inadvertent, and sometimes there are repeated people. People who do repeated misconduct. So what really is research integrity, and publication ethics falls under the gamut of this. So there is something called peer review week. So this may be slightly new to some of you, and it's helpful not only for reviewers but also authors. So peer review week happens once every year, and generally it is in the mid or end of September. And the theme this year, so if you can see the dates, this is 19 to 23rd September. So today is 27th, right? So this just concluded the week before, and the theme was research integrity, creating and supporting trust in research. And, so this is coming from a peer reviewer's angle. So I have penned down a summary of some of my learnings on this, and, I can share a link to this later on if some of you are interested. But, a lot of this that I'm going to talk about comes from some of the, some things that I've learned on research integrity and publication ethics. So what is really ethics? There are things which we could do and things which we shouldn't do, right? So if you look at the definition, moral principles that govern a person's behavior or the conduct of an activity, right? So what it is really moral, isn't it? So it's basically a little bit of a gray zone. And overall, there are so many different definitions of ethics, but I think this makes a lot of sense where Porter Stewart says that ethics is knowing the difference between what you have a right to do and what is right to do, right? So essentially, what we all want is to do the right thing, right? But sometimes we err. So things could go unethical, right? So like I said, there are no hard and fast rules on this. Yet, how do we know whether we are going wrong or not? So, the body which really gives us all these sort of definitions of what is ethical and not is called the Committee of Publication Ethics, that is the COPE. So it's now completed 25 years of its functioning, and let me quickly show you its website. So I think this is something that at least all the editors and reviewers in this August gathering should understand. So this is how the website looks like. These are some core practices, and they have a lot of events. I'll talk about paper mills in a little bit. So there are a lot of guidance and a lot of guidelines that they all give. So this Committee of Publication Ethics is really what we should all be following. And so me and Dr. Santosh have co-authored a special editorial in the second month when we took over at the the running of the IJO, and this is publication ethics. And so right in the abstract we talk about COPE, that is the Committee of Publication Ethics. So please take a look at the website and know more about what is happening and what is not. And this is a quick checklist of what the editorial talked about, and it's of course free, and you can go ahead and read a lot of some of this. So I thought we'll discuss a little bit about approval and consent, data plagiarism, data accuracy, plagiarism, and others. But I would really like to concentrate more on some of the newer topics that are coming out under publication ethics on paper mills, contract cheating, preprinting, and others. But then we'll still take a look at some of the traditional topics of approval and consent. So what does this really mean? So I mean, it's not just taking consent for a study, but what it really means by approval is the paper that you're doing or the study that you're doing should have ethics committee approval, and every study should take the institutional ethics committee approval. And people say, I have a retrospective study and there are no ethical concerns, and why should I do it? So I think current guidelines states that every study, irrespective of it being prospective or retrospective, must be submitted to the ethics committee. And a lot of ethics committees, retrospective studies may be submitted, but they are exempt from full review. So the member secretary and some other members may go through your study and they might really actually identify that there are no ethical considerations and hence may give you an approval. But then, it is mandatory that you submit it to the ethics committee. And then, another question that you should ask, especially if you are looking at an external ethics committee, is that committee registered? So the ethics committee should be registered with the DCGI in India and constituted as per the Schedule Y, Appendix 5, that is basically given by the ICMR. And what consent really means is an informed consent, right? So what information you're giving to the patient should be in black and white, right? It should be part of your study protocol as well. And it should be designed as per the template given in the Schedule Y published by ICMR. We don't have a lot of time to go into the details, but if you look at the Schedule Y and that's the Appendix 5, you actually will get information on how an informed consent form should look like. And key aspects of consent should be, it should mention the patient's rights in clear language, including the right to withdraw at any time without any consequences. And these consent forms should be maintained, and as per regulations, you need to maintain these consent forms either in paper or digitally for at least 5 years. Then comes data manipulation and data fraud. So I'm sure these are some really burning questions. So what these under this heading, what comes is data fabrication, where data is not at all generated. There is no data. Then and a study has been built based on completely spurious data, right? So there is no data, so that is entirely fabrication. Others could be data falsification, where data is manipulated to get desired results, right? You can do it in terms of say I have seen people having an Excel sheet with 20 patients, but they have not duplicated, not triplicated, but just copy and pasted it 10 times over. So 20 into 10 is 200. Now they show a sample size of 200, but actually it was only 20 patients, so you can falsify that data as well. And of course, you can do many things with statistical analysis to show what you want, right? To get your desired results. And of course, there are, nowadays data can also be purchased, and some of it is legal, but then unlawful data purchased from spurious databases is also not allowed. So there are many large databases in the US and UK. The largest one, is the Medicare and the Medicaid data from the US government, and researchers can actually purchase that data and do proper analysis on that. There are some other databases like the Enhance database. There are some databases on for fundus images. If you have artificial intelligence, you have to run it through lakhs and lakhs of images, right? So you can actually purchase data in a legal way. But then unlawful data purchases can also come under malpractice. So, how to suspect, I think from an editor's point of view, how to suspect, you need to get some statistician's opinion on plausibility of that data. Sometimes you look at confidence intervals and, things like that and try and find out if there is something wrong here. Too large a sample for that setting is sometimes, sometimes indicative of that. So, for example, I have received a paper on, outcomes of say 300 ROP babies from a small town in Iran. And when I looked at that institution, I thought that it's almost impossible for them to see so many patients. And, I did not see even one vitreoretinal surgeon who was part of the authors who were, that website did not mention any of those names, so things like that can be looked at. And of course, one needs to develop a keen sense of data analysis. And what you should do when you suspect data fraud is, ask for a complete data set and source code used for analysis. So by source code, I mean is the statistical software used for the analysis always has a syntax or a code which is written. So SPSS has one, Stata has one, SAS and R and all of these. So, you should ask the author to submit this within 24 hours. If more time is taken, that means this is not ready and it's being cooked up, right? So the author should be able to submit it ASAP. And we need to be clear on what we're looking for, isn't it? Instead of looking at the entire source code, maybe we look at only 2 or 3 important outcomes and see whether it's all matching and, things like that. So data malpractice can actually be caught. And third important question is on plagiarism or plagiarism. Now, this is an example I'm just going to show you. So this is an actual paper published in 2015 by some colleagues at Johns Hopkins. They say the importance of ophthalmic imaging was recognized as early as 1886 when an article in the Philadelphia Photographer described a technique so and so. This is a paper which is plagiarized. It says the importance of ophthalmic imaging was recognized as early as 1886 when an article, whatever. So it is a word-to-word copy. It's a like for like. So this is the result section where this says before implementation of the DICOM workflow, so and so percentage of testing encounters required some level of intervention. Here it says before implementation of the DICOM workforce, 19% of testing encounters required. This paper is an absolute word-to-word copy. So when you are in the editorial line, you will come across some of these eventually. So plagiarism can really be. This is clear plagiarism. It could be literal copying, that is word-to-word copying, like I showed you. It could be substantial copying. It could be paraphrasing, that is, not exactly verbatim, but almost entire the ethos of the whole paragraph is the same. And recycling can also be termed as self-plagiarism when an author uses the same text in multiple papers without citation of the previous work, right? Because many times, especially your materials and methods will be the same, but the outcomes are all going to be, the outcome is different. So, how can you change your materials and methods so many different times, right? So, remember that you can say that, it has been described in detail in another paper and cite that previous paper. So this is one of my blogs. I hope it will, take you to the blog. So this is plagiarism in medical journals, and you can look at my website. So, it talks a lot about all of these and how it is being caught. And this is clear plagiarism. This is something that I told you about, how editors approach it. So Committee of Publication Ethics really gives us the major guidelines on how plagiarism should be approached, right? So, we use a software which is called Authenticate. And so this is one of the outputs from a paper on Authenticate. So this is the Word document, and when you upload it to Authenticate, in a few minutes you get that Word document back, and it actually gives you this metrics. This is a percentage of, it is a similarity score is what they call it. So if this is 27%, that means about 27% of the paper is similar to some other papers which have already been published. So what is that cutoff point below which we call it substantial plagiarism? Say if this number was 90%, that means it is almost word to word, right? But if it is 4%, again that is uncommon, because that there may be again malpractice if it's very, very low. So generally, most times we would get a number around, say, 15 to 20%, and that is actually all right. So this is how an Authenticate output looks like, and this is how most international journals detect plagiarism. So there are other things like submission fraud, where you don't submit it to more than one journal at a time. There are many, concepts about authorship and, who is an author and who is not. And most journals, including the IJO, will give you definitions of authorship. Conflicts of interest means, there are things which you are holding back, and, you're trying to show a product or say an imaging device better than it is based on, some of your own interests, right? So, say, for example, it's your own device and you have a patent pending, and you are the sort of author of that first paper, but then unless you declare that, people will not know, right? So these are some other things which are part of publication ethics. But I would, like I said, like to take your attention more towards some of the newer concepts. So paper mills, contract cheating, pre-printing, and ethics of that, image copying, and micro publishing are some of the things I thought we'll talk. So what are paper mills? They're not really mills which are churning out white paper that we routinely use. But, so paper mills really are cash for publication. So COPE has come up with a whole document on paper mills along with STM, and, you can actually read it on their website. So how do they define a paper mill? It says the process by which manufactured manuscripts are manufactured manuscripts, right? So they are out of nowhere, right? So they are not based on totally fraudulent, totally spurious. So manufactured manuscripts are submitted to a journal for a fee on behalf of researchers with the purpose of providing an easy publication for them or to offer authorship for a sale. Okay, so these are paper mills, and these are really very high quality papers. So say a author who is writing a paper for the first time will not be able to produce that kind of quality of papers, right? So we'll see how they produce it and all, but generally these are what paper mills are. And this is one paper mill from Latvia. So if you look at the website, it says you can buy an author's position or an entire article. So these are actually in the open, isn't it? So they are really selling three things. One is the whole paper. Other is an authorship, and you could pay separate amounts for from the first to the sixth author, and that depends upon the impact factor of the journal, how much that journal is costing, if it's an open access journal, etc. And then they even purchase entire journal special issues. And then they manipulate the whole review process. So be careful if somebody is some external agency is asking you whether they could make a special issue for, say, the Kerala journal or the TNOA journal or whatever. Be very careful about these, and I would say probably should not do it. So they're totally fraudulent. And how do they work? They really are working behind closed doors, right? But then they have websites. So how they really work, and how do they bring about high quality papers, isn't it? So they, remember, are all using artificial intelligence at the back end. And there are many AIs like Jasper, Copymatic, and many more who can actually produce the whole introduction, the whole methods, of course, some of the results and a lot of the discussions based on what you feed that AI, right? So therefore, these papers are really high quality. But then you'll realize that the introduction is very high quality, the methods is slightly less, the results is really poor quality, because of course the AI is not going to be able to know the analysis and others. And then the discussion again becomes very high quality, right? So it sort of goes up and down like that. So paper mills, the papers essentially look like that. How as editors and reviewers should you try and identify these? So a quick checklist is, so far these paper mills are a lot into basic science papers. They have a similar layout for most papers, similar sounding tables, similar looking graphs. The affiliations of all the authors are not specific to any particular university. So you need to really look at the background of the authors who are submitting this. You will notice that these are generally new authors with new ORCID IDs. They have no credible work behind them, and hence, they may not be able to produce this high quality of a paper. They don't have institutional emails, which is not surprising, especially even in India. But these are some of the things you can look for. The ethics statement is missing in their paper. So if you suspect this, you must ask the authors to submit an ethics committee approval from as many universities that they are involved. There are many changes to authorship after acceptance. So as an editor, if you are getting a paper who are asking for a change in authors repeatedly, then suspect this. And images are not original most of the times, and we'll quickly take a look at how you can find plagiarized images. So after paper mills, it comes something called contract cheating. So contract cheating is really outsourcing your whole work to an external agency. Could be a paper mill or anyone else, without doing any work at all to satisfy authorship criteria, right? So it is recommended that you do the bulk of the work, that is collect data, put it on the Excel, do a basic analysis, write a rough draft, and then you could take help of an external agency. There are Editorials and American journal experts and many others who actually help with all these manuscript preparations, but you need to still do the bulk of the work. After this, preprints are very much in vogue, especially in the COVID era. So these are a lot of these preprint servers like, BioArchive, MedArchive, Research Square, and others. So these are open science where, a paper is put online and it has a URL and a DOI, that is digital identifier, even before peer review, right? So this is, somebody could really say to a naive person that, oh, see, my paper is published, and you can send a link to that. So some people may call it unethical, but then others, there are lots of merits to this. There are a lot of plagiarism, which is happening in preprint servers as well. People are plagiarizing papers entirely and putting it up on preprints. Now, these preprint servers don't have plagiarism checking software as yet, but then I think these are some practices which need to be brought into this. So, like I said, there are a lot of advantages of preprinting quickly. Where you can actually scoop protection, that is, you can say that this is my work and this is something that I have done for the first time. These are generally journal compatible, they are of good quality, and they are smoother paths to publication. And a lot of journals are now encouraging people to submit it as preprints. And then there are some, I think it's very important to have regulations and best practices for preprints. And the organization which is really doing this is called AIOS-IJO, that is Accelerating Science and Publications in Biology. It's a non-profit. And, I'm part of the AIOS-IJO community. We are about 552 people. And we have, meetings once in a month, and a lot of things on pre-printing are discussed. And as part of peer review week, we had a lot of presentations. So yes, there was a lot of learning on that. Something new which is also coming up is called micro publication in biology. So this is get your data out and be cited. Let me quickly take a look at, show you that website. So, this micro publishing or micro publication biology is run by Caltech. This is one of the largest, universities in the US. And, they are indexed by PubMed, PubMed Central, Europe, PMC, etc. And, if you look at their, what they do, what they're really doing is, if something which is not worthy of a whole article, and you have something to report and it needs to get out to the world quickly, then micro publications is the best way to go. Again, however, whether this is ethical and whether you are okay with this is something that we need to think about. Another new thing that is happening is, or that has been happening for a long time, is image copying, right? So routine software such as the Authenticate that we use routinely are not able to catch image copying, right? So the images are taken from one journal, you modify it a little bit, and then you can put it in a new journal. So Image Twin is another software which is now in vogue, and it's going to come up. So image, I'll quickly take you to the website. This is Image Twin website. If you scroll down, you will see how it works. So you need to select your PDF or your JPEG. You need to, the software will scan, and then it'll give you, based on what has already been published. So it is looking at pixel by pixel and giving you a citation score or a match score of whether this has been published before or not. So image score is something that, or Image Twin is something that you can also look at as editors' journals, as well as if there is any misconduct. So what we really looked at is, overall the summaries. We looked at some approval and consent based on the Indian guidelines from BCG and ICMR. Data accuracy, falsification, fabrication can be caught. Plagiarism is really important to weed out, and we use good softwares which are now available. And then we looked at some newer concepts of paper mills, contract cheating, pre-printing, and plagiarism, especially in pre-printing, and whether it's ethical and all. Then we looked at micro-publishing and image copying. So these are some of the things that I thought we'll discuss. And this is my website. I think most of you are aware of this. There's a lot of learning material here, and this is a much longer course. If anyone is interested, there are nice blogs on p-values, regressions, and a lot of these things on thesis to journal articles. And a lot of people are enrolled in some of these courses. So feel free to take a look at the website. Thank you very much, and I'm happy to take questions now or later.
Thank you, Dr. Sengupta. Your presentation was really mind-boggling. To say it was, that would be an understatement to say that it was mind-boggling. It only reinforces the fact that it would be even more difficult for editors and future editors of our journals to find out these problems. But then again, becoming aware is the first step. And thank you very much for your input.
Thank you.
Dr. Santosh, would you like to?
I think he put it in very great perspective. He's coming up with a article, I think, for IJO in the next couple of months, summarizing all this. So that should be a good resource material. These are some of the newer concepts, some of which are legal, some of which are paralegal, some of which are illegal. There's a very hazy zone of separation between each of these. So how you would like to tread this path is up to individual authors and also to journals. Especially this micro publication thing is catching up in engineering in a great big way, and it is legal there. So in biology, it is not so legal so much. Right, Sunny?
Yeah, yes, sir. So because Caltech is driving that process, so it's really taken up in the engineering sphere, but not in biologies. But the paper mills are very much more in the biology spectrum, and more so in fields like cellular and basic biology, where people are talking about Western blot tests and a lot of the other basic tests which are being done. So a lot of those images can be taken from somewhere, and you can change and make it genuine. And a lot of those tests are so specific that a lot of us will never realize that this was probably never done. So in the number of reviewers which are available to review some of these manuscripts is also very less. So they can sort of play havoc in that sphere. But as yet in clinical sciences, it hasn't come up. But, having said that, having artificial intelligence based software writing the whole paper, that's a completely different ballgame. And, I'm not really sure how easy it is to sort of identify those, but then, we really need to be on our top game.
And there are websites on which you can create very beautiful histopathology pictures. Just name the disease and fill in a few parameters, whatever is the, say, nuclear cytoplasmic ratio, etc. And you'll instantly get the most beautiful microphotograph. It will look very real. Nobody can catch it.
Yeah,
pathologists haven't identified.
Yeah, and also, these what these softwares use, like image twin, is metadata, which is sort of the the what is there at the back of the picture in 0 and 1 that we can't see, and it's something like a QR code which is specific for every image. So if this software is creating that image, it's not going to be copied from anywhere else. Yet it is spurious, right? So how do you identify? So these things are going to get tough, but a lot of work is being done to negate all of this as well. So if somebody has attended the peer review week, there are a lot of things which are happening, and a lot of editors, a lot of publishers like Elsevier and Wolters Kluwer and Springer Nature are all getting together to make a resource, so that things like this can be prevented. So if you blacklist somebody in today's world, there's no way of telling someone else that, oh, he's a plagiarizer, or this is a repeat offender, or this is a paper mill from Russia. But then, if you have, there are some private organizations, say Research Watch and, things like that. But then there is no large database which has all these names in one place. So, I think these people are trying to create one, and ASAP-IO is one of the major ones. And so we've had a lot of meetings on, how this can be done without actually, disclosing the content of the paper, and so there's a lot of legal issues there as well. So things are moving, and, we'll see how that goes.
Thank you. And Dr. Santosh, would you like for some concluding remarks?
I just want to thank KSOS and KJO for this wonderful initiative of partnering with IJO and coming up with this nice program. Sorry, we overran time, I suppose, but I think that happens. So thank you very much.
It was a very fruitful discussion. Thank you very much. Thank you, all of you, for participating. Thank you very much.
Thank you so much.
Thank you. Thank you, everybody.
Good night.
Good night.